For getting a clavicle fracture repair under isolated nerve block, you require at least two nerve blocks, a combination of interscalene nerve block with cervical plexus block, either superficial or intermediate, is at least required for getting the clavicle fracture repaired. Even then, there may be some sparing of the lateral pectoral nerve or the nerve to subclavius. So there is a complex nerve structure which supplies the clavicle, but these two blocks usually suffice. And if there is still some sparing, then the surgeon may locally infiltrate it. Let's talk about these two blocks individually: landmark guided and PNS guided. For interscalene, you can see in the image that the posterior border of the sternocleidomastoid at the level of cricoid, you have to palpate the groove. The first groove is between the anterior scalene and sternocleidomastoid. Then the second groove is between the anterior and middle scalene. So the second groove at the level of cricoid, that is C6 level, you will insert the needle, and usually at a depth of 1 to 1.5 centimeter, you will get the twitch for PNS. And if you are doing for landmark, then you will get a paresthesia at the shoulder level.
You can see the needle is being pierced at the cricoid level in the interscalene groove, and once you insert, you get the desired twitch on the PNS.
For cervical plexus block, you can do either superficial, that is infiltration along the posterior border of sternocleidomastoid at the midpoint of sternocleidomastoid muscle. And for intermediate, you will choose the same point, that is the midpoint of this length, that is this point. You will blunt the needle.
Feel for the bounce and then the first pop. That is the investing layer of the cervical fascia. Give 5 to 8 ml of the drug there.
To get the first pop, that is the investing layer of the cervical fascia. You don't have to pierce the prevertebral fascia. Investing layer is enough, and then you can aspirate and give 5 to 8 ml of drug for intermediate cervical plexus block, which is better for covering the deeper branches of the cervical plexus as well.
Share this video among your friends to let everyone know about these two blocks.